Welcome to the Training Stimulus podcast. This week we have an episode specially made for the clinicians, the chiros, the osteos, and the physios. We are rejoined by a very special guest, Tash Osgood, who is a chiro who has become a very well-known hybrid clinician. The topic today, we're going to talk all about how we can combine treatment with training. It's a question I get a lot from mentees and applicants for the mentorship, is how can I blend in movement mechanics to my manual therapy or hands-on treatment? And they work so well together. But I thought the best way to answer this question would be to get Tash to tell you how she's actually doing it in real life, because she is applying everything that we teach to great effect. So in this episode, we're going to learn how you can blend treatment and training, how to negotiate the way that your clinic does business, and how to get the best results for your patients by applying manual therapy and movement mechanics magic. That's enough for me. Let's get into it. Tash, treatment and training is what we're here to talk about today. So as a hybrid clinician, question number one I have is, when did you first start combining chiropractic treatments with some training as well?
So I would say I probably started to dabble with the idea probably about 3 or 4 years ago. So at the time I was still within 2 clinics. So I worked part-time at them both, but I also did, on my day off, I worked with my weightlifting team. So that was stuff that I kind of did for myself. But I made the appointments a bit longer so that I could start incorporating some rehab and just doing a bit of strength training with them rather than it just being treatment, because that was kind of my view in terms of long term of how I wanted to treat people and how I wanted my practice to be, etc. And so it started off with me just it wasn't using them as guinea pigs, but it was kind of like seeing how I could make it work with chiropractic and what I had known before, like all of my hands-on treatment and stuff. So I just started doing some rehab with them of the knowledge that I had to start with. And I just started seeing better, longer lasting results with these individuals. Especially all of them were much more like on the athlete end. So they trained 4 or 5 times a week. They were weightlifters, they were CrossFitters, like fit individuals who needed to have these sorts of this sort of treatment and this sort of approach to enable them to be able to train, whether that's pain-free or to move better or whatever. And I kind of was starting to think, I was like, right, this is probably an approach that I think works better rather than just hands-on treatment, which I knew was working for people, but I didn't think it had that longevity really for it. Then obviously, as we've discussed before, I was in the weightlifting and world and training, etc. And that's when I came to see yourself for all of my injuries, because I was getting the receiving end of that as well, in terms of I was getting hands-on treatment and it was great and it really, really helped. But the certain injuries and niggles just kept returning, or it wouldn't be one returning, it would just change a little bit and things just weren't clicking. I just couldn't get on top of it. So that's why I booked in to see you, did my movement assessment with yourself, and not just for me as an athlete, but for me as a professional and a clinician, I was like, this is cool. I like this. And it just widened my eyes to how different the approach was to just your normal bog standard, just rehab. And it made me see God, I don't actually move that great, to be honest. And it's like, it wasn't scary. It was more just like, that is probably why X, Y, and Z keeps happening and blah, 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 blah. So we had that. I did my rehab and all of my training and movement stuff that you gave me, and it just helped so much. So then I kind of used what you gave me and kind of applied it a little bit to some of my patients. And I started dabbling with a little bit and being like, right, okay, well, they move similar to me, so maybe they need something similar to this. And I kind of just started playing around with it and trialing and erroring a little bit. And most of the time it worked. And I was like, oh, so that's when I then messaged, and obviously I joined on to the mentorship, and it genuine. So that was about 2 years ago, and I literally, it's just been, I've not looked back really. It's completely changed. It's not just what you learn on the course, it's how you then kind of apply it to everyone else, because you can have, even if you took it as an approach of like, this is what the main things that you see, blah 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 blah, but you can apply what you might have found at the hip to something that you found at the shoulder, then being like, right, okay, if this is like this in that plane and this plane and whatever. And ever since I've done that, like, it's just helped me see the main thing that I've taken away from this new approach is I think that I can see like how people move better. Like, I'm looking at the person as a whole. I'm looking at the person, how they move. Like, if you just lie someone on a bench and do your testing and just do a bit of range of motion and stuff like that, it works and it helps. And you get an idea of what's going on and you can get a diagnosis and you know how to treat them. But if you're not getting them up moving around and seeing how they actually use their body, you're not going to get the broad picture and you're not going to get that long lasting result for that person. And that's kind of what I've definitely taken away from the course. And it's then just giving them, I'm still do a lot of movement assessment stuff in terms of people's rehab, but I also do your normal rehab that you would give for anyone. Like, sometimes, yes, that's boring, but that's what you need. Like, if someone's got patella tendonitis, for example, you're getting isometrics, you're getting like anything to calm down the inflammation at that tendon, etc., as well as the movement mechanics, which probably have caused you to have that knee problem. So it's kind of treating the symptom and the pain and the issue, as well as making sure that you're fixing the cause as to what's happened, rather than just being like, your knee, you've got tendonitis in your knee, okay, let's just fix that. There's probably a few other things that have been going on which actually have caused the issue. So that's kind of how I've
Brilliant.
into it.
Yeah, there's so many great things in there. I think that's an amazing overview of how you can combine the two different worlds to have the best effects. You mentioned a couple of times longevity and sort of long-term results and the improvements that you've noticed with your clients and patients. What does that actually look like? Like, if you could compare and contrast when you didn't use the hybrid approach to you using them now, like, what sort of differences do you see in the outcomes for your patients?
So there's 2 points that I kind of guess link together. It's the reliance on me or as a clinician. So obviously people come to see you to get better, but you can't be with them 24/7 all the time. Like, you need to make sure that they know how they can manage their injury or their pain or discomfort day to day, and how you can manage it beyond that as well. And I found that the people that I would just treat would get better, but then it would come back, or it wouldn't ever 100% go, or there was then something else that kind of went on. And yes, I could give them advice about going to the gym and training and this, that, and the other. And the people that would be more on the side of, they would go to the gym and they keep themselves fit and healthy, they responded a bit better anyway. But people who didn't, you didn't get anything. But as soon as I started incorporating rehab and movement assessment and movement mechanics work into my practice, these are the people that then had tools for themselves to help if they had any flare-ups. So for example, someone comes with lower back pain, I've given them their rehab and their tools, they've done something that might have just triggered their back, and they would be like, right, let's just do some of my rehab and my movement stuff and see if that helps. And 9 times out of 10 it does. And it's giving them that tool to be like, I don't need Tash, like, I don't need to go and see her, I can do this myself. And having them to have their own responsibility for their own journey of their injury as well, rather than it being like, oh my God, I have to go and see Tash. Because it also, at the end of the day, if they keep coming back to see me, there's then that pressure of it being like, I have to fix them. But it's just not how it works. Like I could be like, this is what I think is going on. This is what I think is the issue. This is what the injury is. This is how we're going to treat it. But it doesn't mean to say it 100% works all the time. And that's what they expect. If you just turn up, you treat them because you're doing all the work. Like I would be doing all the work if it was just treatment. Whereas if I'm like, right, this is your rehab, I am giving you this tool. The only reason this is going to work is if you do it too. And that's where that change has happened. And like the difference in response to treatment has happened is because they've not become as reliant on me. So like the next thing this links to the next point, is that people don't have to come in to see me as often. So I do still get like people, a lot of, I'd say 80 to 90% of my patients are CrossFitters, weightlifters, powerlifters, strongmen, like fit individuals who obviously train a lot. Like a lot of people do like maintenance treatment because they do a lot of like, they do 5-6 training sessions a week, and like they just want to look after their body. Like that's fine. It's not necessary treatment to do because they're injured. It's more so because it's just another form of recovery for them. But a lot of them aren't coming in with an injury because we've sorted that. Like a lot of them are coming in being like, shoulders just a bit tight, this, that, and the other, blah, blah, blah. But they aren't coming in because they have to. If they have to come in for a treatment, I would say like people come in probably maybe 2-3 times every 2-3 months, like just to check in, see how things are. They go, right, these have all gone really well. I feel like the rehab's a bit stagnant now. I'm just starting to notice a little bit here. Okay, let's quickly do a reassessment. Let's just check how things are moving. Do we need to change X, Y, and Z? We'll do some treatment. We'll go into the gym. We'll go get you on the rig. We'll go and get you with the barbell. We'll get you moving around, having a look, see what's going on. And then be like, right, this is what I think we need to tweak. Let's tweak that. Go off for like 4 or 5 weeks. Let me know how you're getting on and we can go from there. So it's more like the main things that I think have changed is people being less reliant and people coming in less frequently, but getting quicker and longer lasting results because they're actually getting to the bottom of what the injury is. But it's not just that. It's obviously by them doing the rehab and doing the movement assessment, you're actually treating the cause of the problem rather than just treating it and calming information down. And yes, the treatment can fix it, but it doesn't necessarily keep it there.
Very good answer. Yeah, I think you hit the nail on the head there. And what did you say? Quicker and longer lasting results is exactly the way I see it as well. But the point you also were talking about where they would come in to check up on things, I think one of the underestimated things for the human body training and adaptation is that we're always adapting. So whatever you've been doing for the last few months, if you're pushing your body hard and training towards some sort of goal, your body hopefully is adapting. And with adaptation comes changes to your movement patterns, for better or for worse. The body is just constantly adapting to what you've recently been doing with it. And people kind of have this idea that the way you move is relatively fixed. And there can be long-lasting, well-established movement patterns if you've been, playing one sport for many, many years of your life. But if you're working on things, if you're changing your lifestyle, if you're moving in different ways, your movement patterns will change. Your training program is going to change. So there's always going to be new and different challenges being imposed on your body. So having these checkups, I think, is incredibly useful, not only to get ahead of potential imbalances and injuries, but also from a performance perspective. You can iron out some creases from the early warning signals rather than waiting until it's a problem or a performance plateau. And I think, the smart athletes that you're working with are aware of that and they can feel it in their own bodies. So they're like, this is starting to get tight. Let's see what's going on before it's actually an issue. And I think that's one of the underestimated big value adds from applying movement mechanics to any sort of coaching or clinician practice.
Yeah, I couldn't agree more. And I think that's one thing that a lot of people do need to understand is that if you are training towards something, like that is what you said there was perfect, is that your body is constantly adapting and it's constantly changing it, it's constantly changing it, how it moves and everything like that. And I think that's, so when people, again, it's very different of how you would approach the term, but like maintenance treatment, it's not necessarily about the fact that you're just trying to keep on top of injuries. Your body has probably changed the way that you're moving and the way that it is for over the last like 4 to 6 weeks, because you've trained in a certain way. So what you had 6 weeks ago might be a little bit different to now, and that might have then changed how your body is adapting to your training and how you're moving. And that could be like, oh, if there's something else that has changed there, that could then lead to potential injury. So you want to make sure you're keeping on top of it to make sure that everything that you're doing is right, is best for your body, because the way that you might move and the way that I might move might be completely different, but it doesn't mean to say that we're both wrong. It's wrong. Like your movement patterns is right for you and my movement patterns are right for me, and it still works for what we want to achieve. But it is constantly, the body's constantly adapting to everything, which is a good thing. You just need to make sure that it's for the right reasons as well.
That's exactly it. I think if you've been doing some movement mechanics or rehab exercises, hopefully you move differently. Like if they're having an impact on the way that you move, you want them to be moving differently. So maybe the thing that used to be your weakness or your limiter is now no longer your weakness and your limiter. And so you find the new weak link in the chain to bring you up to the next level. So I think that some people have the idea that they get some movement mechanics once and then those are their moves the rest of their lives. If you're doing them well and your body's adapting to them, you should at least be able to progress them to more advanced versions of the same moves. But maybe, that weak link is now no longer the one you need to focus on. So having a check-in and
I agree.
a refresh is always a good idea. Thank you for that. Go on. There's something else.
Yeah. No, I was just going to say the one that stands out, that classic one that stands out, is when someone is just, their mobility is not great. So you work on their mobility and they come back and they're like it still feels really sore, like my hip feels really sore, let's just say. And I'm like, okay, let's just have a look. And they've actually got so much more mobility. And I'm like, right, so we've dealt with that. Your body is now moving so much better because it's now gained that mobility. However, the thing that we now need to address is actually getting you used to moving in that range of motion, because at the moment your body doesn't know how to move in that range of motion. So that is now the next step. The reason why it's still probably feeling sore is because you've increased the range of motion, and your body and your muscles and your tendons don't know how to adapt to that range. So we now need to just get you used to that, and you need to get you stronger in that position. Like that's the most classic one that I see with quite a lot of people, is they go, I don't feel like it's got really any better. And I'm just like, well, actually, it has. It has. You just can't see that because it still feels painful, but actually you've just now got so much more range, but your body's adapted to that new range, but it's not able to stabilize there, and that's fine. But that's the next step that we're going to work on, is making sure that you can get used to that new range of motion.
That's a massive one, actually. I think it's really important for people to appreciate that, because people often think the more mobility you have, the better it is and the less likely you are to get injured. But quite often it's the other way around, where you have too much mobility. And I think the one that sort of helps people visualize this is if you always squat to parallel, that was your maximum depth in a squat, and then you improve your mobility and now you're getting arse to grass, you're actually increasing the range of motion through most of your joints of the lower body significantly. So all the muscles are getting much longer. The tendons are going under more strain for a longer period of time as well. So it's a very new stress on the body. And if you've been squatting to parallel your whole life and now you're asked to grass, that takes time for those connective tissues to catch up to the rest of the range of motion, where you were very strong, you were very skilled, and you probably were a lot more stable because you spent a lot more time there. So it can be good. And if you needed more depth, then you want to work on it. But the process of bringing all the movement qualities up together needs to be considered. And like you say, it's just plotting those stepping stones on the journey towards where you actually want to end up. long term isn't always as
Mm.
simple as it is at the start.
Yeah.
But yeah, thank you for explaining all of that. I think that's a brilliant setting of the scene. But one thing I want to get out of today's episode is just a little bit of detail on the sort of how your services have evolved and the nuts and bolts of what that actually looks like. Because I know we've got a lot of clinicians who listen and they're going to be thinking, okay, I work at a clinic and I've got these fixed appointment times and standard way of doing things. I want to evolve and become a better clinician, but I'm not sure what those steps actually look like to offering, full muscle imbalance assessments and longer sessions and maybe more programming and stuff. So how would you describe the evolution of your services? You mentioned you're doing one day in the gym with the
Yeah.
Ronin guys. How did you sort of bring everything
Yeah.
together?
So I know that I ramble, so I'm going to address it bit by bit. So the evolution of it was, as I said earlier, I started off with doing the treatments in the gym, just by myself, and then once when it really started to change was when I started with the mentorship, and I started incorporating the movement assessments into my practice with on my days off and doing that then. When I started doing that was when I started getting busier in my own practice. So doing the stuff with the Ronin and going around the gyms and stuff like that. And when that started getting busier, that was when I had to decide whether I should stay at my clinics or not. And I was like, well, maybe I'll just reduce my hours there so I can start picking up my own stuff. And then it ended where I stayed at one with reduced hours, but I left another and built up my own stuff. In that, I then had to decide what sort of service I then wanted to provide and like how long my appointments were and everything like that. And I felt that I wanted to spend more time with my patients or my athletes because I feel like they just would get a better quality service from that. So an initial appointment would still be an hour, which they had been at my other clinics, but any other like a standard follow-up appointment would be half an hour rather than 20 minutes, what I would normally have done in my other clinics. That even just that extra 10 minutes allowed me to be able to spend an extra 10 minutes going through rehab or any other things that they kind of needed. And I felt like I was like, okay, this is a good amount of time to start with, like to go through some stuff. I think the hour for the initial consultation was enough. When I then started incorporating the movement assessment, obviously during while I was training, I kind of just used people and I like to do the movement assessment on, and I kind of started piecing it together, being like, right, how long would I want to start with, like to do a movement assessment initial appointment? So if I wanted to do an initial appointment, I said, realistically, I want to spend as much time with that person as possible to be able to give them the best outcome, and I can get the most amount of information from them as possible, from a normal standard assessment, from a history, from the movement assessment, etc. And so I was like, right, an hour and a half I think is sufficient enough to be able to try and do everything. To be honest, I end up probably blocking out a little bit more with most people because I try to make sure that I think we'll divulge into this a little bit later. Okay. Actually, I'm not going to say it yet. I talk a lot during the session to explain to the patient like what's going on and what I'm finding. So I normally do like an hour and a half to hour 45 to do like the initial consultation with a movement assessment, and then like the standard follow-up. And then I started thinking, right, well, I quite like going through the rehab with the patient. And if people need rehab or they're coming in and they're like, right, this is the rehab, it's good, it's going well, okay, we need to progress this now. I need a form of treatment or session to be able to do that with the patient, because the one thing that I found is quite like, as much as I like the idea of like online coaching and programming, I feel like a patient gets a lot more from it when they're in person. So I made another appointment available, which was an hour session where you would basically get, depending on what you wanted, is you would get either an hour treatment if you want an hour treatment, or we would do a bit of treatment and then rehab. We would do reassessments. We do this and this. So we've got a whole hour to fit for whatever that person needed in that appointment time. And it allowed me to be able to then go through with the patient. So for example, I had seen them for their first appointment for 90 minutes. I've gone away, written all the notes up, written all of the information up, and been like, right, these are the things that I think we need to address. This is the injury. I've written up their rehab plan, and then they come back in and we will go through their first phase of their rehab together. I'll video everything and we'll do all of that in that session. And then if I'm like, right, I think we need a treatment before we progress it again. So maybe they'll come in for a follow-up if they need the treatment because it's really acute, for example. Fine. If I don't think they need that, then they come in 2-3 weeks time. We'll do a treatment and we'll do we'll see how they're getting on with their rehab, do a little bit of a reassessment, be like, right, brilliant, you've been able to progress this, or you're really good at this, that movement mechanics better, you're not getting any pain in this anymore, brilliant, let's progress, let's do the next stuff. So then we'd go through that in that next session. So that's kind of where my treatments is like based at the moment. As of recently, kind of just changed it up a little bit more. So I'm going to spend a little bit longer with the movement assessment. And I've obviously brought on 2 people to the clinic. So they're now going to help out in terms of more the treatment side. And I'm still going to treat, I'm still going to be a chiropractor. But a lot of people who I'm getting through the door at the moment who want to see me are people who want movement assessment, who want rehab, who want the kind of the whole package. So I'm going to try and focus on them. And if they then end up being like, I feel like, I don't know, my shoulders just flaring up a little bit, I'm like, okay, go and see Bradley or Beth, just for a treatment, just to see how you get on and see how you feel. But then you can come back and we'll go through that. But I definitely think that is that's been the best way and the best approach, is just spending more time with them. The next point that you got asked about was how would you address this if you're in a clinic and you've got like shorter appointment times. So the honest answer is, if you've got a good relationship with the clinic owner, have a conversation with them to see if you can provide a different type of treatment session. I had very the clinics that I worked at were amazing. I loved them, and they allowed me to provide that sort of session. I was allowed to provide a movement assessment for an hour and a half. I was allowed to have longer sessions. And actually, in fact, when I asked, they then were like, well, there's a lot of patients who actually want longer sessions. So they actually did it for the whole clinic, because some patients wanted like a double session. So I had a conversation with them and they were able to allow me to do that. I'm going to be, again, really honest, like 20 minutes for an appointment, if you want to incorporate a movement assessment and rehabby stuff, it's not enough time. Like, it's not enough. It's fine if you want to do just the hands-on treatment, like there's nothing wrong with that. But if you do want to incorporate it, I would suggest having a conversation with your clinic and seeing if you can make something work, even if you can just offer or say to people, right, you just need to have a double session, rather than it being just a 20-minute. If you've got 40 minutes, that is a lot of time to be able, if you can do a treatment in 20 minutes, then you've got 20 minutes to be able to go through the rehab and a bit of movement assessment or whatever. If you can't, for whatever unfortunate reason, to be able to provide that, then definitely think about trying to do something like that, like outside of the clinic. That's obviously how I started. It's nothing against the clinic. It's just about, you've just got to remember that if that's how you want to practice and that's how you want to work, you've got to go and do it. And if they're not allowing you to do that, then that's just hindering the progress that you want to make in your career and how you want to be able to treat your patients. And you've got to prioritize yourself and how you see your career going. And so ways that you can do that is just speaking to gyms, because if you're going to just do more movement assessment work, a gym's sufficient enough, really. Like, you can go and do the movement assessment somewhere, and you can go through the rehab there with them. If you're already in a gym community, you can go and do that sort of stuff, and speak to the owners and whatnot. Like, that's probably the best approach. A lot of gyms tend to have a treatment room. If they do, utilize it. Like, see what you can do, even if it is like an afternoon a week to start with. Like, that's how I started with mine, and then it just grew and blossomed from there, really. But I know that is something that a lot of people do. When I have quite a lot of people coming in to shadow me, that is the one question that they have, is how do I approach this in my clinic where I've only got 20-minute appointments? And I get it, it's hard, but you've just, if you've got a good rapport and you've got a good relationship with the clinic owners, and it doesn't, obviously as a business and a clinic owner, they're going to think, right, well, how is it going to benefit us? You've got to respect that as well. Like, you've got to see it's got to benefit them in some way or another as well. But if you can have that open dialogue with them and be like, this is how I really want to work, this is how I want to practice, is there any way that I can do X, Y, and Z, and whatever, really realistically, at the end of the day, the worst they're going to say is no, and you can be like, okay, that's fine. You can then go and start thinking about finding another space to do your own stuff. Like, you don't have to do it in a weird way. Like, you can just be like, right, there's a few patients that I have that I want to do a movement assessment with. I'm going to get them to come down to the gym. Even if you do a movement assessment with them outside of the clinic, but they still come in to see you for treatment in the clinic, fine. But like, you've got to find a way that works best for you, so that you can practice in the way that you want to, in the best possible way as well. So that would be my advice in terms of.
That's really, really good advice. Thank you. I think that'll help a lot of people. And I think the sort of overarching message there is that the North Star, the thing that guides all the decisions, is what gets the best outcomes for the patients. And it sounds so obvious, but a lot of businesses will set things up in a way for maximum profit. And some practices will offer 10-minute appointments explicitly or not. And this is one of the bad experiences I had when I was going around the houses with my own injury, that I would go to a chiropractor and have a half an hour appointment, and he'd turn up 10 minutes late, and then he couldn't be done with me fast enough, literally just quick adjustment, didn't want to answer my questions, and then he'd be out the room 10 minutes early. And I saw what happened. He basically was lining people up so that he would do 3 half-an-hour appointments in one half-an-hour slot. He had 3 different treatment rooms, and he would just rotate around, finishing one early and starting the next late. And obviously, from a financial point of view, that's incredible. From an ethical point of view, it's fucking awful. This is like, there are businesses like that out there, which is one of the reasons why I find this so refreshing, where you're doing something which is almost, in air quotes, bad business, short term or short-sighted, but long term it's great business, because you get the best results and you get customers who are going to trust you long term and recognize that you have got their best interests at heart, rather than, oh yeah, we just do 20 minutes because that's what we've always done, and that means we can see more patients in a day, and that works out better.
And I think that is a massive thing. And I think, especially as a business owner, and I think I probably am on the more uncommon end, I guess. I love what I do and I love my job. And obviously, we need to earn a living, like, obviously. But there is not one part of what I do is because I want to make money, is because I love what I do and I love helping people. And if your patients see that you care and that you genuinely want to get them better, that is good business in itself. And I do a bit of marketing, I do social media stuff and whatnot. I would genuinely say about 85 to 90% of my patients is all referrals. I think I've maybe had about 4 people from Google. That's about it. Everyone else has just been referrals because I've got people better quicker. So yes, it looks like the retention is not as good, but actually for the long term, yeah, the retention's not good, but I'm just constantly getting more people through the door because I've got people better quicker. And that's still good business. Like, I think people forget that. Like, I know that on paper it doesn't seem it, but when you've got constantly a wait list of people being like, I'm sorry, I can't see you for 4 weeks because if I'm full, that's still good business, rather than having someone to see like, oh, that patient's been seeing me for 3 years. Why are they still seeing you for 3 years? Do you know what I mean? Like, it's one of those sorts of things that I think that's a really good, important thing to address as well, is, as you said, just if the patient sees that you care and that you're actually like so involved and dedicated to making sure that they can get better, they are more invested as well. Whereas if they can, as you said, if you just can tell that you can just tell that they're doing it for money and they really couldn't give a shit, you're just kind of like, well, I don't want to come and see this person because they don't actually want to get me better. They're just trying to take my money and they leave.
Yeah, that's exactly it. It's a really funny, I've never heard anyone describe it like that, but actually having an anti-retention or a high churn is a good thing when you're in an injury rehab business. You want people to stop working with you as quickly as possible because that means you're doing your job very effectively. And yeah, it's kind of anti most business advice. But like you say, that's very short-sighted to think that's bad business, because ultimately if you get the best results the fastest, then you're going to have a lot of people queuing up to use your services. So that's a very cool way of framing it. I wanted to come back to something else you said earlier when you were talking about the different sessions you have for people, whether it's an onboarding, full assessment, a follow-up, or just a treatment session. How do you navigate that with your clients to decide whether they need treatment versus movement mechanics update? Like, how does that work for you?
So everyone is so different, obviously. Like, I think it's a lot of people would generally be like, okay, you're going to have these sorts of sessions. This is how it's structured. Initially, it is a little bit more structured in terms of, right, okay, you've got this like X injury. We need to do movement assessment. You come back in, you'll have your treatment. We'll go through your rehab. We'll then be like, right, okay, so let's maybe see you next week just for a treatment to just calm the inflammation down a bit more. Then after that, it will probably be 2 weeks. We'll go through, that would have been then 3 weeks from when we gave the rehab. We'll then be like, right, let's see how you're getting on with the rehab. And we go from there. So that session, I'd say, is probably a really important one, is because it will give me an idea of how quickly they pick up the rehab, because some people can start doing the rehab and let's just say everyone's doing it as prescribed. Some people would respond to it instantly. They're just very, very adaptable and they're like, yeah, we'll go through it. And I'll be like, oh, like, that's just so much better. I'm like, okay, brilliant, let's move on. Whereas some people, it just takes a little bit more time. So again, rather than, I think we had touched on it last time, being like, this is exactly how we have to do treatment, I definitely take it as it comes, more so like that as a more approach, because if I had 2 people that had the same rehab and this person responded to their rehab up here and this one was not just a little bit behind, but I gave them the exact sort of time frames, the response would be completely different, because this one's a little bit behind, or this one would be stagnated if we went for this sort of ground in terms of treatment. So everyone will get a different time of response. The time in terms of whether I pick to do a movement assessment or treatment just depends on like pain levels basically, and inflammation and how they're moving. Do I feel like something needs to be released off, which is potentially restricting why they can't do a certain movement, why they're struggling with doing kipping toes to bar or something like that? We'll be like, right, okay, let's do a quick assessment. let's treat it, release it off, allow it to move a little bit better. Then I'm going to give you an exercise to keep it in that position. So that is why I think treatment and rehab and movement assessment work helps so much, is because treatment absolutely has its place. I would never not treat people, because I think it helps aid the body. If the body can't get into position, if it's just like, no matter what you're doing, stretching it off, doing any rehab, it just doesn't feel much better. It just might need that little helping hand to be like, right, let's loosen your lat off, let's do your subscap, let's do a couple of adjustments through your thoracic spine, get your rib cage moving a little bit better. And then it's like, okay, now I can get my arm overhead. Brilliant. Let's go into the gym and keep it in that position. And let's be like, right, these are the exercises now that I want you to do. I would say still, regardless of what you're coming in for, people would still get some form of treatment in the session, whether that is 10 minutes of treatment or 30 minutes of treatment or an hour of treatment. People would still get some, because I still like using my assessment like in the room to just double check muscle testing, make sure range of motion is good, just so we get a good picture of where we're at with the body in comparison to where it was at the beginning. If there's still some pain, people still, whether that's mentally or actually physically, like wanting that relief from that discomfort, and doing hands-on treatment is a really good way of addressing that. But if someone kind of comes in and they're just like pain level wise, like I'm actually okay, I'm just a bit achy, a bit stiff, but I'm still just struggling with the movement in my toaster bar, I'm like, okay, let's quickly have a look, do a little bit of treatment, pain levels are fine, all of the like testing, like orthopedic testing and stuff is okay. I think I said muscle testing is good. I'd be like, right, we're now going to just go and spend however long we feel like we need to go through your kick-ping toaster bar to make sure that we can find the right sort of exercise and right movement to actually be like, right, this is what actually is going on. Is it that your shoulder blade can't like tilt back? Is it the fact that it can't elevate and depress properly? Is it the fact that actually your like upper traps are doing too much work and your lats are not doing enough? Like, what one is it, or is it multiple? And be like, right, okay, so we can see that when you're in this position it can't do this, but when you're in this position it can. So how are we going to make this exercise that you were already doing now more specific to this exercise? So it's why it's very hard to say what I do and don't do, because it is a matter to me of how they present in that session, which is again something very different to what a lot of people do, because they kind of have a structured plan in their head, being like, right, they've got patellar tendonitis, so every session this is how this is the progress of how it's going to be. Everyone is so different, everyone will respond so differently, and you don't know what certain medical histories people have in terms of why people will respond completely differently to others. And at the end of the day, some people don't do their rehab. So what are you supposed to do when someone comes in 3 weeks later and you're like, how are you doing? And they're like, I'm not any better. And I'm like, why? And I was like, how's your rehab gone? And they're like, I've done it twice. Brilliant. Like, brilliant. Like, what am I like at the end of the day? And I have that very frank conversation with them, being like you can't expect me to be the person who's just going to fix you if you don't do your job too. Like, I'm not giving you this rehab just because I feel like it. Like, I'm giving it to you because I know that these are the things that are going to help. And we use this session, especially, as I said, that first session after I've given them their rehab, to see how they get on. Like, I had someone in the other day and she was like, all of the rehab's great and I feel so much better. However, these 2 exercises do just aggravate a little bit of pain when I'm doing this, blah, blah, blah. So I'm like, okay, let's have a look. Let's go through what you're doing with the exercise. And all we did was like, okay, the reason why that's hurting is because of this. So let's just tweak that, get you to shift your weight back here a bit more. Let's do the other one. And by us doing that just helped with the pain, because I could see what she was doing wrong. And that's why I think sometimes, actually more often than not, in person, you can actually see what they're doing wrong and you can make those tweaks straight away to be like, this is what it should be feeling like. later down the line, if people don't need treatment and they just need their rehab and stuff, and it's just a bit more advanced, I will do video calls with people, because I'm just like, right, like, we just need to advance some rehab. Let's have a look what you're doing. And I'll be like, right, this is the next things that you can do. And I'll then send videos or whatever, like, because I feel like they're competent enough and they've gained that body awareness by that point, for them to be like, oh, that's how it should feel. That's how it should feel. And that's the nice thing about this as well, which is a kind of little bit of a side point, is that a lot of individuals, their body awareness grows so much with doing rehab and with doing movement assessment work, because they actually know how something should feel, and they go, oh, that's how I should be moving. Oh, that feels weird but good. And it's just like, okay, whereas at the beginning it's very hard for them to do that, but when you're later on down the line with the rehab, that's when it feels better. So it's a hard question to answer, because I kind of just see where they're at that appointment, because I can't expect every single person to be like, I have been perfect with doing my rehab most days amongst my 12-hour days in the office and trying to train and trying to have I get it. And that's another question that actually
that's another kind of one.
I feel like that's another one.
No, that was a phenomenal answer, Tash. That's so good, because I think it touches on so many really important points. Well, I think the macro point there is the fact that you don't have cookie cutter templated approaches to people, whatever their scenario. You're kind of playing it as you see it, and this aligns perfectly with the principle based approach that we're always going on about, in that you learn the rules and then you can apply them as you see fit, as appropriate to the person in front of you. And yeah, the toaster bar example is a really, really nice one, because it also explains why you get some coaches who get better rehab results than some clinicians, because they have the eye for spotting what's not happening. And the toaster bar is a classic one, because it has many components to it and there's many ways you can do it. So even if you are getting your toes to touch the bar, you can be doing it in more or less efficient ways. And yeah, if you're able to see that and apply what's effectively the right progression for that person, so whether you're targeting their hip flexors, their abs, their lats, even their legs and their hands have a big part to play in their grip. If you're applying the right progression for them to work on that weak link, that is movement mechanics, and that is injury rehab. That's treating somebody's issue, which could be something that's causing them pain, or it could be something that's holding back their performance and costing them unbroken reps that they could, like their fitness and their strength, you would think they have. And yeah, I think that's a really important point. And I love the way that you combine it with the treatment to open up the window of opportunity. That's the way I talk about it, in that you're essentially calming down the pain or having a short-term improvement in range of motion to give them a chance to lock in the new movement pattern. And then the movement mechanics is what actually locks it in and embeds that skill so it sticks long term. And I think that's the trap that a lot of clinicians get stuck in, is that they see that it works, they get the range of motion improvement, but then they don't do anything to actually lock it in. So their body's like, okay, well, that feels better, but they don't use it, so they lose it. And then they need to come back, and the cycle repeats.
That's it. That is it. And I think that's a massive one. And I think that is probably why a lot of people who just get treatment don't get the response that they need, is because they've got, the body's like, this feels great. I've got this new range of motion. Everything feels great. Now what? And it just doesn't know what to do with it, sort of thing. But another point that you made about how coaches sometimes actually get better results with rehab than some clinicians is because they have the eye. And that's such a good point, because another thing that I feel that I've benefited from in terms of my progression in how I've worked is I work with a lot of coaches. So if someone comes in, I'm always like, get your coach to message me or give me your coach's email, and I can let them know what I found, and we'll work together, being like, right, this is what I can be like, this is what I saw, this is what I think we need to work on. If there's anything that you feel would be beneficial for that, please do. I've got someone who I have a call with him probably every couple of weeks now. And because I treat probably about maybe 6 of his clients, and we end up just having a phone call and we go through all of them, and we just like, right, this person, they came in, everything felt great. Only they just said that they were struggling with X, Y, and Z. What have they told you? We'll then have a discussion. We'll then be like, right, for their rehab, I'll give them this, that, and the other, but could you give them this? And he'd be like, oh, I think this would be quite, do you think this would be quite good? And we end up, we're speaking on the phone for like an hour, just chatting about our clients so that we can work together to get them better. So it's like, and that then benefits me, because I'm like, right, okay, I've just learned something there actually, because I didn't think about that being beneficial in let's just use a toaster bar again. Like, I didn't think that would be beneficial, but actually that probably is. And then he learns things. He's like, oh, I didn't think about that. I didn't know that was X, Y, Z. And so it's a nice learning experience for the both of us as well, in terms of how we work with our clients. And it's just a really nice way. And then because he would have said something, I would have then looked at someone else's toaster bar and been like, like, I see that now. Like, I see now that why that would be something. And then I'm like, okay, so for other people, I might just always look at that, see if that's something that they need to work with as well. And just because this is where I'm at in my career does not mean that I'm not constantly learning either. Like, I'm still learning every day. Whenever I see people, whenever someone says something else, I'm like, like, I'm not perfect. Like, not everyone knows everything. And that's why I've loved speaking to coaches, because they're the people that, as you said, that have that eye for that movement specifically. Whereas I've got the eye more for why something is hurting and why something is in pain and why someone's moving not in the best way. So when you put it together, it's like,
exactly. Yeah.
It's so good.
I think that's it. Yeah. I think it's brilliant the way that you're doing that, and you're spot on in the coaches. I remember there was like a penny drop moment for me when I basically realized that all the good progressions and regressions that get used for CrossFit is probably the best, because there's so many skills to unlock. So things like toes to bar, muscle ups, they're essentially just emphasizing a specific movement quality that somebody may or may not have. That movement quality could be raw strength, but it could equally be range of motion. It could be activation of certain muscle groups. But a good progression, you see these posts or these ebooks online, which is like 10 steps to get your bar muscle up, or learn to handstand walk in 5 easy steps. All of those things, the ones that are actually any good, they're targeting what is likely to be the missing movement quality. So it could be balance, it could be stability, it could be strength, could be skill acquisition, motor control, whatever it might be. But they're essentially giving you baby steps of the movement qualities that altogether add up to be the big picture skill of a muscle up, of a handstand walk, whatever it might be. Yeah. So the ability to deconstruct the big skill into small skills is good coaching, but it's also movement mechanics, and it's also good treatment and rehab, because in all scenarios, there's something that's lagging behind the rest, which is likely to be the reason either you're in pain or the reason you're not performing in the way that you want yet. Yeah. So it all comes back to the same root, like diagnose what's missing and teach them how to do it or build it in their body, and then you're moving them forwards.
Yeah. I couldn't agree more. Could not agree more.
Thank you. So for any aspiring hybrid clinicians, are there any mistakes you made early on that you could help them avoid?
Oh, so many, probably. Mistakes. I would say it's not necessarily a mistake, but a big learning thing is, I feel like if you don't know a sport, learn to know it, basically. I was lucky enough in terms of CrossFit weightlifting, like that I know the movements, I know what you were like, what joints, ranges of motion, qualities, etc. you need from a joint, a position, or muscle groups or whatever. But when you then got a sport that you don't know, learn to know it, because it is very hard when someone comes in and they're like, they're talking about this terminology about their sport and you don't know it, and you're like, I need to know what you're asking of me, because that is the one thing that I feel, if you do want to go into sport, like, it's very different if it is kind of just your gen pop people, but if you want to go into sport, you need to be clued up in what the sport requires and the demands of the sport. For example, I've learnt now a lot about rowing, because I treat a lot of rowers now, or people have had a history in rowing and now they do CrossFit. That's a huge thing in terms of the difference between like just knowing what the person's doing now in terms of knowing what they've done in the past, because having a rower in, the demands of that sport is completely different to what CrossFit is. They've never put their arms above their head in their life, and then they go to now do some toes to bar and some snatches and they're like, my shoulders are in bits, and you're like, I wonder why. But it's that, I would honestly say, because the amount of times people would start talking to me and I would be like, not that it wasn't embarrassing, I wouldn't say, but it's more of a, I had to be very quite frank with them to be like, what are you on about? Like, you say that your sweep, what side of the boat is the oar on? Okay, so how would you say, like, how were you pushing with your legs? Because it's not just them pulling the oar, you've got to push with the legs, but one leg now I've learned pushes differently to the other leg. And if you're constantly doing that on one side, when you then go to do a squat, obviously the hip is going to move differently on both sides if you're just going to go up and down. And that is why I think that history taking and even having a form prior to them coming in, making sure you know what they've done in the past, what they do at the moment, so you can get clued up on that sport or their day-to-day tasks that they are struggling with, so you get a picture. So when they come into the room, they're like, right, you know the questions that you need to ask if you are unsure. You need to understand, okay, they've gone from a rotational sport really to one that's a bit more in the sagittal plane. They go up and down, forward and back. They've gone from a sport that they don't put their arms above their head, they now do a sport that does. They now go, it's that transition of being like, okay, God, I really don't know about any of these things. And it's just making sure that, but you're also honest with them, like, not, I guess this also links into a big one, is being honest with a patient if you don't know. Because I think there's a lot of people out there who are try and convince themselves that they 100% know what's going on, and that actually ends up getting you worse results, because you're just lying to the patient, but you're also lying to yourself. And if you don't know what's going on, that is okay. Like, that is why you've then got referral pathways. You've got other people that are in your circle or in your clinic or whatever to be like, I really don't actually have a clue what's going on here. Could you just have a look? And the mistake I had made before is being like, oh, I'm so convinced this is this. Absolutely convinced. It wasn't. Like, it wasn't. And it happens. Every single clinician has that. And they're lying if they say they haven't, because they have. And it's one thing that I've taught a lot of people who come in to shadow me is, it's okay to be wrong. It's absolutely okay. But it's more the way in which you deal with it with your patient. If you say from the beginning, this is what it likely is because of X, Y, and Z, this is how we're going to treat it. If for whatever reason it's not responding in the way that we want it to, these are my other things that I am thinking about potentially. They're less likely, but if this doesn't work, we're then going to start trying to investigate these things. So that, because you do need to think about, you can't just be like, oh yes, patellar tendonitis, when actually, like, they could have a meniscus injury, they could have like bursitis. There's like 7 burses in your knee. You could have multiple types of bursitis, which can take even longer than tendonitis to heal. Or they've got some form of inflammatory arthritis that you just didn't know about because they didn't have the classic presentations of it. Just because it doesn't present like it on paper does not mean that that's what it is. And I think that is the one mistake. I wouldn't even call it a mistake. It is just a really big learning curve. It's okay to be wrong, and it's okay if you've not diagnosed them correctly, because not everyone necessarily needs a scan or whatever. But you got to be at the point where, okay, it's not responding. This is what we thought it could be if it was a worst case scenario. Let's get a scan. Let's see what the scan says, see if there's anything on there that is of significance for why this isn't responding. Okay, that's come back with this. That is probably why it's not different. Like, it has come back with what we thought, but also this extra, which is probably why when you're doing ABC exercise, that's why it's actually flaring it up, because they're not beneficial to this. And you then just work with it. But it's being very transparent with the patient and being very honest with them, to also just say to them, we're going to give this a go, and hopefully this is going to help. Like it should. But also, if we don't get that sort of response, these are the steps that we will be making if it doesn't respond. Again, if you don't get that response from that patient, but you've been honest with them and you said to them, this is everything that we're going to try and do to help make sure you get better, you're still going to get the trust from that person, because they know you said from the beginning, like, if you can't help and these are the steps that we need to make, because I might not be the right person for you, I'm going to make sure that I can get you to the right person, because I'm not for everyone. Like, there's some people come to see me and it's just not the way that I practice, and the way that I treat is just not for them, and that's okay. It's not the end of the world, but someone else is going to be better for them. So I think people just need to know that it's okay to be wrong, but don't see that as a bad thing. Just see it as a learning curve in terms of how you approach your patients and how you can communicate with them.
That's a really important message. I think again, it's sort of long-term thinking. Excuse me. I think a lot of professionals early in their career don't want to seem like they don't know what they're doing, so they can, like, I know I've been there for sure, where you're kind of embarrassed to not have the answer straight away, so you feel like you need to portray confidence. But confidence doesn't just come from 100% accurate diagnoses. You can be confident in that you know how to plan a contingency, in that if you're not right, so you can go, right, this is based on the information, this is what I think is going on. But exactly like you articulated earlier, if that's not what it is, we can pivot and look at things from an alternative perspective, get new information, and you can be confident that you're going to do the right thing later. All anyone can ever do is their best. So your best sometimes is going to work, sometimes it's not going to work. But if you're okay with it not working, and have confidence in your ability to adapt and do your best to help them in whatever way possible. And if it's not possible, hold your hands up and say, yeah, maybe it's not, like, what I do isn't right for you right now. Then you can be confident that, yeah, in any scenario, it's going to work out and it's going to be okay. And you're going to do your best for them. And I think, like you said before, people can almost smell it. Like, there are definitely some people, like this chiropractor I was working with before, you can sense their ulterior motive. And if that comes across, that's not good for business either. So being transparent to just say, I'm going to do my very best, going to try and get you the result you want as quickly as possible. This is what I think is going on. This is the plan I've laid out. And let's crack on with that, see how it goes. And then we will get feedback whether we're on the right path or we need to course correct slightly.
Exactly.
Awesome. And I also like the sport point as well. I think that's something that maybe I've taken for granted, and that when I think one of the reasons why you and other hyperclinicians do so well is because your patients feel like you get them. There's nothing worse than going to see a professional who does zero sport, zero training, and they look at you like you're a weirdo. And they're essentially, I remember I've been told this so many times, just go and do stationary bike, sit on the bike for 20 minutes. That's good exercise. I'm like, you just don't understand me at all. At the time,
You
I was
just don't get
a
it.
teenage rugby player being told to sat on a bike as my exercise. And if you can show them, you get where they're coming from, you understand their passion for sport or training, and you want to get them back to that,
Yeah.
then they're going to be immediately more bought into the process because you're on the same team versus they're turning up
Yeah.
with a professional who's trying to get them to stop doing the thing that they love. And yeah, I think we spoke about that last time, but
Yeah.
that's a really powerful thing to be able to communicate.
Yeah, I agree.
Great. Okay. One question I had was, has there been anything surprising that a client has said to you as you changed your approach? Because, a lot of people might turn up expecting an old school traditional treatment, but has anything surprising happened? Sounds like it has.
Oh God. I hate saying this myself. Like I can't believe I'm about to say it because oh God, but it's a common thing. It's a common thing that people say to me on a regular occurrence, and they just call me a wizard. They just call me a wizard, and I'm just like, okay. I'm like, all right. And but it's the fact that I think because maybe it's the way that I've changed my approach, but they've also just not had someone who's been able to assess them so much. And then within a treatment, even just from a treatment, they're like, why does that feel better? I'm like, well, because of, and then I'll explain it and they go, that is, God, you're a wizard. And I'm like, okay, but it's just a common thing that people say. I even had, well, obviously my name's Osgood, and someone said I was the Wizard of Osgood the other day, and I literally went, oh my God. I was like, I've not heard that one before. And
That's good.
I loved it. I was like, that's so funny. But I think that's just what, and it's really, I cannot believe I'm saying this as that people call me that, but like, that's what people call me. And it's because it works. And it's because I will do everything I can to make sure I can find out what's going on so that we have the best possible, clearest picture, not just for myself, but for the patient as well, for them to understand why they're in pain and why this is what's going on. And like, even I had a patient recently who, like, he's just had like on and off shoulder problems, like, and came in. I went, right, I was just like, we're stripping this all the way back and we're going to do like another reassessment for your shoulder. And we just found something else that hadn't come up before. So it's probably similar to what we said about like how his body has been adapting, this, that, and the other. And it just come up which hadn't presented before. So I literally gave him like 2 exercises because he was struggling to even like hang on a bar, or it was just hurting his shoulder so much. And within 2 weeks, he's now back on a bar, fine. Like, he's got no issues. He was just like, it's the best my shoulder's probably ever felt. And I was like, sick, brilliant. And it was just because we just stripped it all back, ignored everything else that we've done, did a reassessment. What did we see there and then? Right. That is probably why this is being caused, because probably all these other things are working, but that was always a hidden thing. But now everything's moving better and your body's adapted to this new way of moving with your shoulder. That's now actually not been targeted. Let's quickly target that. Here's a couple of exercises for you to try and address that. Done.
Perfect.
And he was just like, that's just magic. Yeah. And I was like, it's not, but okay. Like, it's great. It's great that you think that, because but I'd much rather people think that, like, be like, this is unreal. Like, the fact that you've been able to find what's wrong and fix it this quickly, which is, again, linking back to what we said before. It's like, what's the point in dragging it out and people keep coming in to see you when you're actually not finding what the problem is? They want to come to see you to find what the problem is. And if you found what the problem is and you fixed it, you're a wizard.
That's it.
Like, and yeah.
Love it. Yeah. I think the analogy I love for this, as you're talking through it, ironing out the creases. Sometimes when you iron one part of the shirt smooth, another part of the shirt crinkles. So it's just a question of slowly getting them out
Yes.
bit by bit.
That's
And
great.
that's how I always
Yes,
explain it when I
that's a
do my
really good
sessions.
analogy. I like that.
We're going to get rid of this crease,
Yeah.
but sometimes another crease will pop up somewhere else. And then it's a bit like whack-a-mole. But
Yeah.
obviously the overall trend is a smoother shirt overall. So that's what we're working towards, but it's not always
I
plain
like that.
sailing. So that one is a perfect example
Yeah.
of it, in that, yeah, something else rears its head and then you just deal with it as it comes.
Yeah.
Tash, thank you so much
Yeah.
for your
I like
time.
that
That
one.
was incredibly helpful for so many people. And yeah, I'm sure the downstream benefits will be massive. Give us a quick reminder of where to find out more about you, or maybe book in a session if somebody's in London.
So on Instagram, I am Osgood Movement. Email would be tash@osgoodmovement.com. I'm based in London in Elephant and Castle. So if you ever want to come in and see me, just let me know.
Brilliant. Thank you so much. And we'll see you on the next one.
Thank you,
Cheers.
Ash.
Hopefully there are a ton of practical takeaways for you there. It's always super insightful to learn from Tash and how she's putting all these skill sets into practice in real life. If you would like to learn the Movement Mechanics Mentorship in the same way that Tash did, the information will be in the description below. Just click the link, and if the fit seems right, you could submit an application. There is also a link to stay up to date with our new and exciting offering, the Hybrid Clinician, which is specifically targeted at the chiros, the osteos, and the physios who want to apply movement mechanics to their practice. So click that, put your email in, and you'll be first to know about any updates, and there'll be some special discounts and bonuses for those who are on the waiting list. That's enough for this week. Thank you for listening, and we'll catch you on the next one.